For the last part of the female reproductive system, we're going to talk about just the pregnancy overview and quite a bit of pathologies in this one. So we're going to review the sperm and the egg, implantations and chromosomes, just to refresh your memory from basic anatomy, go through pregnancy, where it occurs, the delivery process, and some pathologies that include the placenta, the breasts, abnormal placental implantation, and more. First question, a somatic cell is the same thing as a body cell. So a cell in your heart, a cell in your liver, lungs, whatever, they all have 46 chromosomes. A gamete is specific for a sperm or egg cell. How many chromosomes does a gamete cell have? 46 or 23? And the answer is 23. So a somatic cell, 46 chromosomes, and the gametes include the sperm or ovum, and they have 23 chromosomes. So I think of the gametes as part of the game of love. You put two of them together and they create 46 chromosomes. So always the ovum carries an X chromosome, and the sperm had their option of either carrying an X or a Y chromosome. So this shows the game of love, the gametes, 23 each, oocyte, sperm cell, creating a zygote. So the game of love going from X and Y, or X to X and to Z, XYZ, creating a zygote that has a total of 46 chromosomes. Question, so which parent determines the gender of the baby? Is it the mother or the father? And the answer is it's the father. So in this one, gender is determined on the father's side, whether your X sperm gets there or a Y sperm gets there. So XX is a female, XY becomes a male. Medical scenario, a 26-year-old woman has a positive pregnancy test. She gets it at home after missing her period. Then she starts having pelvic pain. On the pelvic ultrasound, nothing is seen in the uterine cavity. So she's had a positive HCG test, and she has what you would call an ectopic pregnancy. So after the first week, mid-cycle, by the time she was supposed to have her menses, that zygote should have implanted within the uterus. If it's not there and she's got a positive HCG level, then there's a pregnancy developing in some other location. And these are showing all the other locations that it could possibly attach. And these are like in the peritoneum, outside the uterine cavity. Unfortunately, if they're within the fallopian tube, these are places where it can rupture. And if it does rupture, there's massive bleeding and, of course, death to the embryo, but also potential death to the mother because it's a very vascular area. The mortality rate for ectopic pregnancies is 0.3% in developed countries, but in developing countries, it's up to as high as 3%. So that comes with a saying from Africa, a pregnant woman has one foot in the grave. Lots of things that can go wrong and little access to medical care. And this is just an image actually off the internet, but it's showing how the embryo can grow outside of the uterus. And the risk factors for having ectopic pregnancy are prior infections of the pelvis. For instance, like STDs, sexually transmitted diseases, can cause inflammation of the fallopian tubes, and they can get strictures. Smoking has a higher rate, and if someone's had tubal surgery, say that they've had a reanastomosis of their tied fallopian tubes, they have a higher risk of developing a ectopic pregnancy. This is showing how fertilization occurs actually distal, much more distal than you think. Most people think it occurs within the uterus, but it doesn't. It occurs right close to the fimbria of the fallopian tube. So the oocyte is expelled right here around day 14 of menses. And if sperm is available, that on day 0 is fertilization right here at the distal end of the fallopian tubes. And then it turns into a zygote right at day 1. And remember, it's the zygote that is excreting beta HCG. So the implantation is going to occur 7 days after fertilization. The placenta, going on to the placenta. This is showing the placenta, on the baby's side, the umbilical cord's attached. It's providing oxygen, nutrients, IgG, antibodies. Remember from the immune system, the blood system, IgM antibodies can't cross, but these small IgG antibodies can cross. So it gives the baby some immunity right at birth. It removes the carbon dioxide, the waste, but it does not share red blood cells. And this is bloody, but that's not, this is outside. This is an actual placenta after delivery. So they are bloody. And this is the mother's side. And all these little irregularities in the surface are cotyledons. They're placental segments. And after delivery, the obstetrician or nurse practitioner, somebody will check this side of the placenta to make sure that none of these little spots here are missing. If they're left behind, it's a substantial increase in placental bleeding, endometritis, infection. So you want to make sure all of those segments are delivered during the 3rd stage of labor. All right, let's talk about placental complications. There's abnormal placental implantation, and there's also placental dysfunction. Placental dysfunction is when the placenta starts getting old, around 40 weeks. Actually, it starts to shrivel, and the babies can have difficulty growing at that stage. It can also develop placental dysfunction and cause eclampsia or preeclampsia. So first of all, the placental implantation. This is an image of a low-lying placenta that's covering the cervix. What would happen during labor? Vaginal bleeding, so much that the mother could die, fetal hypoxia, the fetus not getting oxygen, or uterine outlet obstruction. And actually, all of those are possible. So with a normal placental implantation, they can pick it up on ultrasound. So that's what's so very nice in developing country. When you do have an ultrasound, you can see where the placenta is and make that decision to do a C-section well before the mother goes into labor or well before the cervix starts to dilate. So following delivery, what is the main thing that stops bleeding after placental separation? And by the way, as part of the stages of labor, the second stage of labor is the delivery of the baby, but there's a third stage where it's actually a delivery of the placenta, where the placenta separates and is delivered. And the bleeding, is it from blood clots or uterine contractions? And the answer is uterine contractions. So it's during this period of uterine contractions that the muscles compress the blood vessels. And there's a situation called uterine acne where the muscles are flimsy, loose, boggy. All those words are used. And patients will have significant uterine bleeding. So a case presentation, this is a true story. 19-year-old who was delivered at home by a birth attendant. She had a retained placenta. The attendant forcibly pulled on the attached umbilical cord. And what she developed was this image of the inverted uterus. And this is just an image off the internet. The real one is not shown on my YouTube presentation, only in the classroom. Patient had a massive amount of blood loss. In this situation, the uterus cannot contract, and she died from blood loss. So the placental abnormalities, invasion, can be of like 3 varieties. So accreta is when it's getting into the wall, like the myometrium or the muscle layer of the uterus. And then increta is further, and percreta is all the way through. And if they do not separate, if the placenta does not separate at birth with gentle tugging and uterine contractions, then this requires a hysterectomy. And then this incidence increases a lot more with women with multiple pregnancies, scarring. All right, let's go on to another subject. How about twins? Which type of twin will always share the same placenta? Could it be identical twins or fraternal twins? The answer is identical. So they're identical are coming from the same ovum, one egg, one sperm, and early on, the blastocyst divides and creates 2 identical twins. Now with fraternal twins, they have separate amniotic sacs, they have separate placentas. They can be male, female, or 2 males or 2 females, but identical twins are the same gender sharing the same placenta. Now, the hormones, all these hormones are going crazy during pregnancy, preparing the body for feeding an infant. So we'll go through the implantation, delivery, and breastfeeding. Start with your medical scenario. Your sister is 2 days late for her period. She pees on a test strip that measures elevated levels of beta HCG. This displays as a positive pregnancy test. But just a memory recall, what is producing beta HCG? Is it the ovum, the embryo, or the endometrial lining? The answer is it's your embryo, fertilized egg. So these early embryonic cells start producing HCG, and the test is measuring this beta subunit. So this beta HCG is stimulating the corpus luteum to continue producing progesterone, kind of a cyclical nature. It's secreted into the mother's blood and detected in the urine as a positive pregnancy test. This is showing the weeks as they go by during pregnancy. Early on, you're going to get beta HCG being produced by the fetal cells, and that does level off around week 20 of pregnancy. And then, of course, estrogen is stimulating the breast to develop, the uterus to prepare for delivery. It will stimulate oxytocin receptors for labor. And to counteract that to a certain degree is progesterone. That's the green line. And progesterone goes up and stays up until right at the very end of pregnancy, where it drops off. And then the estrogen and oxytocin are unopposed to start uterine contractions. And then, of course, the prolactin being excreted by or being secreted by the posterior pituitary gland. No, it's the anterior pituitary gland. And it stimulates the breast to produce milk. So at 40 weeks, progesterone drops, estrogen, oxytocin get labor started. So let's just a few little things about labor and delivery. Stage 1 can last a long time, especially if you're hurting. Stage 2 is when the baby is delivered, and stage 3 can be, it's not quite as long, maybe 30 minutes to an hour, delivery of the placenta. So here's stage 1, the cervical dilation. Stage 2, the baby's being born, and stage 3, the placenta is being delivered. Okay, next thing, we're going to make just a couple comments about breasts. Your sister shows you a spot below her left breast. She says that it becomes tender and swells every 4 weeks. What is your diagnosis? Is this a mole or our second nipple? And the answer is it's a second nipple. It's along the milk line. Well, these are supernumerary nipples. The medical term is polyphelia, many nipples. It's not a disease, a disorder, it's just a thing. As a matter of fact, this is Mark Walberg with his accessory nipple. All right, so let's talk about mastitis, some of the complications that happen after a baby's born. So much is going on, milk is being produced, that bacteria can get inside these open ducts and create abscesses. So this is an obstruction of lactiferous ducts, quite common during breastfeeding. Breastfeeding is not nearly as easy as you would think. So to summarize all this, we've got fertilization to implantation. You've seen the hormonal changes with pregnancy to delivery, the delivery process of not only the baby, but the placenta. And then we talked about the breasts and your extra nipples and gave you a chest shot of Mark Walberg. So a baby will make love stronger, days shorter, nights longer, bankroll smaller, home happier, clothes shabbier, the past forgotten, and the future worth living for. That's on a good day. Any questions, please leave comments and subscribe to the channel. Thank you.